It's been a year like no other, and the unprecedented weathering of storms has done a number. Many continue to suffer under the pressures of an uncertain future for us all, especially those who seek to rise after they fall, slipping between the cracks of the inequities to holistic health, for the marginalized and those lacking wealth. There's a lack of equity and inclusion in our healthcare system. For those who fall victim to accessing the appropriate care, in East Toronto, the South Riverdale Community Health Center is there. For years, the South Riverdale Community Health Center has been on a mission. Creating empowered, healthy, and thriving communities has long been the vision. No matter how far, they're willing to go the distance. With the relentless goal to improve the lives of those who face barriers to physical, mental, spiritual, and social well-being. Driven to redefine the narratives, the center has keyed into evidence-informed programs, services, and approaches, working to fix the cracks of a system damaged and broken, working for those hit hardest living on the margins, those silenced, those facing domestic violence, refugees and newcomers, and people who use drugs are prioritized. Together, the center and its stakeholders harmonize to reach a single accord. The center is key to unlocking those closed doors. The SRCHC is a passionate advocate for equity and inclusion, a leader in community health, an internationally recognized movement with a wealth of knowledge and evidence-informed programs, services, and approach. The center breathes life and gives hope to those who need it most. With cutting-edge health services that broaden the scope, the SRCHC is a bridge between where healthcare has been and where healthcare is going, a bridge that keeps a stream of holistic health services flowing. The center has provided programs to gather around a table of good food, with the opportunities to grow, cook, and share, believing in a world where everyone can access nutritious, affordable, and delicious food prepared, because access to delicious and healthy food should be a right. Holistic food sustains a holistic life. We've seen the clear disparities through COVID-19 that have forced the center to pivot. Essential staff put ears to ground and listened to those affected most, providing safe, supervised injection sites to safely get a dose, keeping people alive through the opioid epidemic, providing a judgment-free access to a medic and a shoulder to lean on when times get bad. The frontline workers have long had their backs. Essential staff have long supported this population that has been stigmatized, working to reduce the barriers that keep them criminalized. As the COVID-19 infections rose, so too did the numbers that overdosed. Across Ontario, these numbers doubled for the homeless and the underhoused. The SRCHC provided PPE and helped provide food in their mouths, providing light to those living under darker clouds. I've learned that equality is giving everyone a pair of shoes, while equity is giving everyone a pair of shoes that fit. The center strives for excellence and benevolence, setting a precedence in holistic health practices, advocating for equitable treatment for people of all backgrounds, shapes, and hues, because none of us are free until we can all tell our truth. Racism has been declared a public health crisis, and we can all do our part to do what is righteous. For those who have fallen, we raise them the highest, because access to affordable and healthcare should not come with a bias. It should come with reliance, with the goal to build community and bridge an alliance. The goal is for community members to leave better than when they entered. Staff listen, research, and services are rendered. This is the excellence of the South Riverdale Community Health Center.